Something that some women might face in their sexual lives with their partners is a sexual pain disorder. Now, I know what you might be thinking. This is just another silly ad that is going to try to sell me some type of remedy that is extremely expensive. However, this is far from that. This is not your average infomercial. However, it is geared towards educating women towards understanding their bodies to take the right steps to seek help if they are experiencing any symptoms that would be discussed shortly. What most women don't realize is that they might experience painful intercourse at some point in their lives, according to the Mayo Clinic. However, this pain might sometimes be brushed off or ignored, even when it shouldn't. If you find yourself feeling like something might be wrong, ask yourself these questions. Are you experiencing genital pain or discomfort while engaging in sexual intercourse? Women, does it hurt to insert a tampon or menstrual cup into your vagina? And lastly, is this affecting your sex life? If you answered yes to any of these, you might be suffering from one or both of the most common forms of sexual pain disorders, and this one is dyspareunia. What is dyspareunia? This is persistent or recurring genital pain that occurs just before, during, or after intercourse. As you can see, once the penis enters the vagina, there is some irritation and discomfort in the uterus and near the cervix. Some causes may include things such as insufficient lubrication, injury, congenital abnormality, and even emotional factors such as stress, history of sexual abuse, or psychological problems as well. Symptoms of dyspareunia includes vulval pain, itching, burning, as well as stinging. Now you might be wondering what the other common form of a sexual pain disorder is, and this one is called vaginismus. So what is vaginismus exactly? The Medline Plus defines it as a spasm of muscles surrounding the vagina that occurs against your will. The spasms close the vagina and can prevent sexual activity and medical exams. In this current demonstration, the left picture shows a normal and relaxed vagina. You can clearly see that the vaginal and uterine walls are healthily open. This vagina would not have a problem when undergoing intercourse. However, on the right picture, you can see that there is tightness and contraction within the vaginal wall, which would prevent the penis from entering the vagina. So what are the causes of vaginismus? Causes include past sexual trauma or abuse, some mental health factors, tiredness or depression, fear of getting pregnant, childbirth, or certain prescribed medication. According to the American Family Physician, these symptoms can range from minor to severe, which would ultimately lead to the women avoiding all forms of sexual touch or intimacy altogether. Not only does this affect sexual intercourse, it could also affect the woman's ability to complete a gynecologic exam or even the simple things such as inserting a tampon. Now, I bet you're wondering, how do dyspareunia and vaginismus differ, and how do they correlate with each other? Well, dyspareunia is associated with the general pain and discomfort that is also associated with intercourse. As you can see in this diagram, the symptoms of dyspareunia can lead to fear of pain, anxiety, and other psychological as well as physical problems that could lead to the involuntary spasms of the vagina. And then this ultimately leads to vaginismus, which interferes with penetration. Here are some different treatments for vaginismus and dyspareunia. One popular form are Kegel exercises. There are many different types of Kegel exercises, but the ultimate goal is to make your pelvic floor muscles stronger. These muscles control your urine flow and will help hold your pelvic organs in place as well. Here is a common form of a pelvic floor exercise. Another form of treatment include vaginal dilators. Dilators are a tapered device used to slowly stretch the vaginal walls of the vagina so penetration is more comfortable. Dilator sets typically come in a wide variety of sizes so that a woman can start a size that is most comfortable for her. Other forms of treatment include sex counseling and therapy, changes in sexual positions, different forms of arousal, vaginal trainers, and visiting a healthcare provider or doctor. Don't wait, cure your vaginismus and dyspareunia today.